I've talked a little bit about the data and just that the birth outcomes and the maternal outcomes for your patients are better than the outcomes for all of Puerto Rico. And so, I've just got a couple of statistics here that that in Puerto Rico, the C-section rate is about 45%, right? And then for Mujeres or for MAM, it's about 12 to 14%. The preterm birth rate for the island is almost 12%, but for your clients, it's less than 1%. So, what do you think is driving these amazing birth outcomes among your patients?
Part of it is the shared care aspect, right? Because a lot of people are really taking charge of their health and that really makes a difference. I also think that a lot of people that come to us maybe have more access to that we even exist, right? There's still a lot of people in Puerto Rico that don't even know that midwifery care is something that is available, or they don't, because we have to, charge, because we're not a government funded organization. Some people might not have the funding to be able to access our care, even though we do a sliding scale, and we have funding that we can offer grants or, even free of charge, but we can't do it for everyone because otherwise we don't exist, right? That we need to do something to help sustain the organization. And I also think that there's just this whole myth behind midwifery care, right? A lot of people don't see it as something that is safe, even though our statistics show that it is. Worldwide statistics show that it is. The World Health Organization and the International Confederation of Midwives have also shown that it is. But it's something that within our culture and our cultural competency, it was not really seen as something safe, right? It became part of that whole smear campaign, midwives, that happened in the 30s and 40s and 50s in the United States. It, translated over here, so people automatically thought, oh, if you're going to have a midwife, then you're not going to have a safe outcome or a safe birth. And so that still permeates, even though we are seeing little by little changes, because there's more access to, social media and to the World Wide Web, and people can research and do their studies. But it's still not the majority. Like, people who look for midwifery care in Puerto Rico is less than 1%.